Having surgery can be an intimidating experience, but we have created this video to guide you through each step of what you may expect in the day of surgery.
Before your surgery, your physician may have you pre-register and go through some pre-admission testing to make sure you are prepared for surgery. Please follow your doctor's orders to determine if this is required. Otherwise, expect a call the night before surgery from one of our registered nurses giving you fasting instructions and any medications you are needing to take leading up to your surgery. The day of surgery, we will have everything ready. You just need to show up on time and register with the receptionist. You will then be escorted to your pre-surgical room and be equipped with a hospital gown. Once you are changed, one of our experienced nurses will do some basic checks and go over information to verify your medical record is up to date. He or she will then place an intravenous catheter in one of your arms for fluid and medication administration. This may sting a bit, but it is relatively easy and nothing to worry about. Only a flexible catheter is left in place. An anesthesia team member who is especially trained in anesthesia will then be in to ask some routine questions. In most cases, you will have a certified registered nurse anesthetist or an anesthesia assistant and an anesthesiologist working together to care for you during your procedure. There are various ways of providing anesthesia to you, but rest assured that your anesthesia provider will customize your anesthetic plan based on your current medical history, patient preference, and the surgical procedure being done. Benefits and risks of anesthesia will be discussed, and you are encouraged to ask any questions you may have. Your surgeon will also see you the morning of surgery to answer any last-minute questions regarding your procedure and have you sign consent forms. One common anesthesia technique is a peripheral nerve block, which is performed prior to going into the operating room. Local anesthetic is injected near the nerves, making the area of surgery numb. This allows for pain management during and after the surgery has finished. This procedure is usually performed for surgery on shoulders, legs, and feet. Most often, this will be done along with general anesthesia. You are now ready for surgery. You will then be pushed into the operating room and transferred to an operating table. Assistance is available if needed. Upon entering the room, you will be introduced to the rest of your surgical team. Monitors are then applied to watch your heart rate, blood pressure, and oxygen levels throughout the entire procedure. While on the operating room table, the anesthesia provider may perform a spinal anesthetic, which involves injecting local anesthetic into your subarachnoid space, which is in your back, using a fine needle while you are conscious to numb you from the waist down for 2 to 3 hours. This is done for surgeries that are occurring below the waist. You may or may not go to sleep for the surgery. Lastly, general anesthesia is the most common form of anesthesia, which is essential for some surgical procedures. It may be the safest and the most comfortable. You will be unconscious and unable to feel pain during the surgery. It is commonly given in combination by injecting anesthetic medicine into your bloodstream through the intravenous catheter in your arm and using inhaled gases to keep you asleep. The anesthetized brain doesn't respond to pain signals or reflexes. Your anesthesia provider will stay with you throughout your procedure to ensure your safety. You will be closely monitored, and they will adjust your medications, breathing, temperature, fluids, and blood pressure as needed. General anesthesia is overall very safe. Most people, even with significant medical conditions, are able to undergo general anesthesia itself without serious problems. Your risk of complications are more closely related to the type of procedure you are undergoing rather than the type of anesthesia. When the surgery is finished, the anesthesia medications are stopped, and you will then wake up either in the operating room or the recovery room. You will probably feel a little groggy and a little confused when you first wake up. You will be looked after by a registered nurse that will attend to you should you have any discomfort or nausea. When the anesthesia has fully worn off and the nurse is happy with your recovery, you will be reunited with your support person and discharged either to your room or home.
Now that you have viewed this video, it is our hope that we have answered some of your questions and have reduced your anxiety about surgery and anesthesia. Good luck to you in your upcoming procedure.